Good evening, everyone. This is the meeting of the Albuquerque Bernalillo County Government Commission plus APS, and we will now come to order for our March 24th, 2022 meeting. Councillor Feeble-Corn was recently appointed to ABCGC in place of Councillor Benton, and she's joining us today, so welcome. I think that this is going to be a great fit, and you are going to enjoy yourself and add a whole bunch for us. CAO Sarita Nair is excused, and Ms. Nair has assigned Mr. Isaac Padilla to attend on her behalf. Commissioner Barboa is expected to be here probably in just a little while, and all other members are present via Zoom. We will have a moment of silence followed by the Pledge of Allegiance. And I would ask Board Member Cordova if you wouldn't mind saying the Pledge of Allegiance tonight.
Absolutely, okay. Sure.
Thank you. We'll start with that moment of silence.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much.
What's that for me?
So, okay, moving on. As was noted in a press release from our office on Friday, posted on our website and noted on our published ABCGC plus APS agenda, this meeting does have special procedures and is being held via Zoom video conference this month. Members of the public, staff, and the media have the ability to view this meeting live through 4 different platforms: GovTV on Comcast, Channel 16 and GovTV website, YouTube Live, and Zoom. These live streams can be accessed from most smartphones, tablets, or computers. And for those of you watching on live stream, thanks for joining us. Agenda item number 2 is approval of the minutes. Are there any changes to the February 24th, 2022 summary minutes? And if not, if there is a motion and a second. Well, I'll motion to approve the minutes from February. Is there a second?
I'll second. Sorry.
Thank you. Thank you, Commissioner. All right. And Ms. Barraza, if you will please take roll call.
Commissioner Barboa? Excused. Councillor Feeble-Corn?
Yes.
Commissioner O'Malley?
Yes.
Mr. Padilla?
Yes.
Councillor Peña?
Yes.
Commissioner Piscotti? Commissioner Piscotti?
She will be here soon. She is not quite with us.
Okay, thank you. Commissioner Casella?
Aye.
Councillor Sanchez?
Yes.
And Councillor Bassan?
Yes.
That passes on a 7-0 vote.
Thank you. Agenda item number 3 is public comment. We've received some written comments in advance of today's meeting and have been distributed via email for everyone to review. Thank you to the individual who took the time to submit their comments. We did have live public comment available for this meeting. And Mr. Moya, I understand we do have 3 individuals signed up to speak.
Yes, Madam Chair. I'm sorry, go ahead.
No, that's okay. Go for it, please, if you let them in.
Sure. Our first speaker is Connie Vigil.
Oh, hi, everyone. Can you hear me?
Yes, ma'am, we can.
Great. Thank you so much.
Your 2 minutes will begin once you start speaking.
Okay. Hello, everyone. I know most all of you here. I want to say that I was around back when Debbie O'Malley first started the initiative on the tiny homes. We had a similar project named Gabriel's Village at the time. I have followed the project and am now on a committee who heard a proposal about 2 weeks ago in relationship to the tiny homes. I will say that the committee does not agree with changing the criteria for admittance, and we want to do everything in our power to help this project succeed. I had a very good discussion this afternoon with Julie Morgas-Baca, Enrico Grade, and Laura Carlisle, who was instrumental in the OT development of that project. And as a former executive director with Habitat for Humanity, I volunteered my services to help this become a positive community effort. I will say I have serious concerns about the proposal and the additional 500,000 and would like to see a thorough investigation and working with Laura Carlisle as an expert on who to hire and how to go forward. And with that said, I'll do anything I can to help this move forward. As I said, Gabriel's Village is in the background of this project, and if we can make tiny homes succeed, I'm sure we can go forward with Gabriel's Village. So thank you so much for the opportunity to speak. Have a good rest of the meeting.
Thank you. Madam Chair, we had 2 other individuals sign up to speak, but they have not joined the meeting. So that will conclude public comments.
Thank you, Mr. Moya. Agenda item 4 is new business. Item A is a discussion to discuss separation of the Department of Behavioral Health Services and Behavioral Health Initiative. Commissioner Piscotti did request this item to be placed on the agenda, and I'm hoping that she is here, but if not, we can go ahead and switch these around.
So I think we should probably push this out a little bit until she can join. She just texted me.
Okay, how about we switch these up then? We're going to go ahead and do item B, which is a presentation of the Youth Homelessness Assessment. The Southwest Center of the Pacific Institute for Research and Evaluation, the Child and Adolescent Services Research Center of University of California, San Diego, and the Homeless Coordinating Council's Youth Housing Continuum Committee's leadership team, which includes core service providers and stakeholders, as well as representatives from CYFD who ultimately paid for the needs assessment, will be presenting on this matter. And the following individuals are going to be presenting. We have Kathleen Wilging, Quinn Dene, David Summerfield, Kim Zamarin, Asata Zere, sorry if I don't pronounce it right, and Danielle Feets. And then we will go ahead and let you all take over and do the presentation, and then we'll follow up with some questions.
Thanks so much, Madam Chair, for having us today to talk about this wonderful data that has come into our community. I know we only have a short amount of time, so we're going to go quickly. And today with us to do this presentation, we only have a small amount of the people that you just mentioned. So we do have Kathleen Wilging and Asada Zerai from UNM. So I'd like to just set the stage really quickly for you all about how we got this assessment. So as many of you know, in the summer of 2020, Mayor Tim Keller formed the Homeless Coordinating Council. The Homeless Coordinating Council was made up of representation from the City Council, the County Commission, and UNM. This was seen as a body to help think of high impact strategies to help meet the needs of people experiencing homelessness in our community. Of the HCC, there was also several committees that were formed part of it, and the Youth Housing Continuum was one. The mayor wanted us to come up with high impact strategies, as I mentioned, and the first high impact strategy that we came up with was we needed to know the numbers, because we did not have data up to this point that told us what the young people were experiencing in our community. We had mixed numbers. We had largely systems data, so folks that had aged out of foster care, that had been in the juvenile justice system. We had those numbers, but there was a lot of young people that were falling through the cracks, that we were not meeting their needs, or we weren't counting them. So we knew first we needed to get this assessment. So we got green lighted through the HCC, and CYFD was kind enough to pay for this assessment to be done. And now all of us can really reap the benefits of this wonderful assessment. So I'd like to hand it over to Asada Zerai, who's going to talk us a little bit more about the assessment. Thank you.
Thank you so much. I'm going to share my screen here. And so the comprehensive needs assessment of young people experiencing housing instability and homelessness in Bernalillo County is a collaboration between PIRE, the Child and Adolescent Services Research Center, UNM, the city of Albuquerque, and Bernalillo County. And so the goals, Quinn has covered most of them, but I'll just kind of give you an overview of all the aspects that we looked at. And so this was initiated in March 2021, and the needs assessment had these several goals. The first was to estimate the number of people aged 15 to 25 experiencing homelessness in our county. The second goal is to enhance our understanding of this experience based on the perspectives of young people, which, you know, that sounds very basic, but unfortunately we just did not have that kind of information before conducting the survey. And hearing about the experience from the people experiencing it, of course, that's going to be most important in terms of thinking about policy. The third goal is to examine strengths and limitations of the service system. And then the fourth goal is to develop recommendations for creating a coordinated and comprehensive community response to improve services and supports to young people who are impacted by housing instability and homelessness in Bernalillo County. And so the structure of the needs assessment, we approached this from a mixed methods approach. And so it had these 5 elements. The New Mexico Youth Count and Housing Survey, which took place in August and September of 2021, and involved what's called a mark and recapture computation strategy, using tallies and brief surveys focused on characteristics and unmet service needs of young people affected by homelessness. And then the second thing was the youth experiences and perspectives on housing instability and homelessness, which involved qualitative interviews with young people with relevant lived experience. And then thirdly, we conducted an organizational assessment survey, which collected information from agencies to provide a high-level overview of the system landscape. Fourthly, the qualitative system and organizational assessment, which included interviews, focus groups, and surveys with system leaders, agency administrators, and frontline providers to understand their sense of the youth population dealing with housing instability. And then finally, the organizational workforce assessment, which analyzed priorities and needs of the key agencies providing the bulk of services and supports to the population of youth who are homeless. And so now I will turn it over to my colleague, Katie Wilking, who will present the next slide.
Thank you. And we have so much we can report on, so we're just giving you some major highlights today. The estimated size of the total homeless youth population, ages 15 to 25, ranged from 1,088 to 2,314 persons, based on the set of sites used in the MARC recapture computations and data from tallies and surveys. This is a conservative estimate or undercount, given that we could not saturate all potential sites due to pandemic conditions and other factors, such as safety considerations and the hidden nature of the population. The young people we encountered were largely sleeping outside, couch surfing, staying in shelters, transitional living programs or residential treatment facilities, or in hotels or motels. Several described engaging in sexual activity for a place to sleep, with one participant describing couch surfing as a business transaction, stating, quote, "You just can't live somewhere for free," end quote. Next slide. A key finding across the various surveys and interviews with young people, frontline providers, agency administrators, and system level stakeholders is the lack of awareness and understanding of what is happening in the lives of young people who experience homelessness and the incredible challenges they face trying to survive in Bernalillo County. Our findings underscore that youth struggling with housing issues represent a largely invisible population that is diverse in its composition, with disproportionate representation of Black, Indigenous, and people of color, particularly American Indian youth and LGBTQ youth. complicated family dynamics and systemic harm such as poverty, racism, transphobia, and homophobia, and inequities in education and employment shape trajectories of homelessness among young people. Involvement in the child welfare system, including foster care and juvenile justice, is not unusual among the young people who are housing insecure and have unique and unaddressed needs related to development or maturation, social support, and unaddressed needs pertaining to behavioral health. Put simply, their treatment needs for substance use and serious mental illness are not being met. Discussions with young people and the other stakeholders make it clear that unsheltered youth are also being placed at risk for violent victimization, crime, being trafficked, and becoming homeless as adults. Next slide. Of note, the primary need identified by youth in both surveys and the interviews is housing, with the majority wanting a stable housing situation in a small house or apartment with coordinated services and supports. This was a consistent finding across all our different points of data collection. These include support for improving their basic life skills, case management, and addressing behavioral health needs. Safety and independence are keys to their ideal living situations. Many interviewees simply want a place to live as long as it's not on the streets and affords some privacy. Many want to live in places where drug use, theft, and violence may be less present. Descriptions of independence shared by the young people largely center on being sober, having reliable transportation to pursue education and employment, and making enough money to pay for basic living expenses. Next slide. And I am going to turn it over to Quinn.
So there are many recommendations in the full report. So if you do get a chance to take a look at that, I highly recommend it. So you can see what we recommend, or rather what the researchers recommend. But right now we're focusing on two immediate asks. And the first is to establish a shelter for young adults that are between the ages of 18 and 25. One option is to create a shelter with comprehensive services, which would include funding for therapeutic support, floor staff, service navigation, food, utilities, transportation, training, equipment, rent, etc. We estimate that the operational cost would amount to about $800,000 annually. The second option is a trimmed down 12-hour shelter option, so a place to sleep at night, with funding specifically for floor staff, utilities, training, equipment, rent, and some food. We estimate that the operating cost would amount to about $500,000 annually. This does not include costs for capital outlay because that depends on whether a new building is built or an existing building is retrofitted. We also strongly suggest setting aside funding for an inclusive planning process for a comprehensive continuum of care that makes use of findings from this needs assessment. CYFD has already agreed to provide seed funding for startup. This process is a logical next step, given we now have some data on the range of organizations that interact with youth with unstable housing and the variety of services that they, one, currently provide, and two, would like to see more of, and the general feedback that more purposeful coordination and integration of services is needed between these organizations. The money needs to cover the cost of a trained facilitator and coordinator who is well-versed about issues of youth homelessness, who can ensure that this work is carried forward, and for resources to involve youth and in the planning process. So that is what we have for you today. Thanks so much.
Thank you very much. And there is indeed so much more information that this group has provided in another briefing that we had. And I think it's very valuable. Please look into more of that if you want more of the details for anybody on this commission that didn't get that before. But Commissioner O'Malley, I see you have a question.
Thank you, Madam Chair. Quinn, you mentioned CYFD, and could you expand on the role or the possible role of CYFD? Because some time ago, they did come to, I believe it was the Housing Committee. They did talk with some of us about that they had funding for capital for housing, and including, I don't know, it was wraparound services. So if you could expand on what their role would be.
So currently, their role right now is they provided the funding to complete the assessment. So that's one way their role has been shown. And then now currently they're involved on the leadership team for all of these discussions we have. As in terms of funding for the future, we haven't had those conversations yet about would they be willing to fund anything. We don't know. We don't know their role.
Okay, it had gone, I believe the conversation had, they had even said that, and this was a spokesperson for, I think it's the director at the time. I don't know if the person is still in the same position, but that they had funding or vouchers. I think it was mostly funding for renovation of maybe a small apartment complex or something like that. So I remember that, and I don't know what happened to that, but so that's something to probably revisit. Thank you.
Thank you.
Commissioner Barboa, welcome. And I see you have something.
Thank you, Madam Chair and Commissioners. Quinn, yes, I had a question. One on the slide, right, it talks about comprehensive care and transitional support, and then it names a shelter. I'm learning more and more to keep asking, like, what are all the definitions of things? Because sometimes shelter, right, is like temporary, it's not housing, this isn't considered a transitional living like the things coming out of this recommendation are sort of like shelter from the elements and maybe for overnight, but it's like, out in the day, or I guess
Yeah, I love your question for clarity. So the idea here is there's a couple different options, right? So the first option is the comprehensive shelter that we're talking about, the 24-hour, would be, it is a place where people can be all the time, 24/7, not just at night. And the comprehensive services would include case management, that would include service navigation, that would include, did I say therapeutic supports? I'm not sure. But it would include all of that in the microcosm of the shelter, right? And so that would be, all your bells and whistles, everything is there. The other idea, the 12-hour idea, is the nighttime idea. But the way it would work is, I think we all are aware of HopeWorks Day Shelter, right? Which is basically an adult drop-in center. So you could have a nighttime shelter, 12 hours for the nighttime sleeping, so people can come out of the cold. And then during the day, they could go and spend their time at a youth drop-in center, essentially, because that then can create movement that can help them connect to other services. Because the idea, remember, with young people, the idea is to exit them from the system, exit them. Whereas with adults, sometimes they're in the system and they are there, and it's hard to get them out. So the idea, the transitional support services, it's basically, Commissioner Barboa, it's anything to get young people to their next step. So that can include life skills, that can include employment support, that can include GED, anything to get them to the next step. I hope that answered your question.
Yes, thank you. And I guess I just want to emphasize, and we're looking at, this full 24-hour, and then I guess the part I want to share, right? And I'm not actually sure what the landscape is now, but way back in the day when I worked at Casa Hermosa, which was the only transitional living program that took young people up to 24. There was another program that CYFD ran that was specifically just for foster youth, but ours were foster youth plus, so anyone experiencing could apply and possibly get in to the transition. Well, I learned over the time, right, that Casa Hermosa, and I think everyone has heard me before talk about differences between billing hours and just running program, right? When I worked at Casa Hermosa, it wasn't so much on the bill. We did have to document billing hours and our time, of course, but that wasn't our focus. And I think after I left, Casa Hermosa now, I believe, is strictly for specific mental health diagnosis, right? I think that's the truth. I don't actually know the truth. And then there's Casa Q, and then so there's maybe a few places that I guess I'm wondering, what's the landscape currently in New Mexico that service this youth, and is there do they have to have a diagnosis? What are all the barriers, and are we filling a gap?
Yeah, so currently, and not much has changed probably since you worked at Casa Hermosa, because it's Casa Hermosa and New Day TLP. They are, the transitional programs. Then there's also Casa Q, but they're for under 18. However, CYFD did award them some funding to provide TLP to some older youth. I believe Serenity Mesa also has transitional beds. Now, I am unsure who provides that funding, but that's neither here nor there. But that's specifically for the folks that are in recovery. So to your question, like we do need more transitional living beds for sure. We definitely need that, because if we have a shelter, but the shelter we're talking about is a smaller operation, like 20 beds. I know that sounds maybe confusing to people, because if you see that large number of people experiencing homelessness, you're like, well, why isn't there more? Well, the idea is it's about quality over quantity, because what you want young people to feel like they're connected. You want young people to have developmentally appropriate supports and all of that. And so you need less. Less is more in this case, right? And so we do need more transitional living. Just the same hitters do it, like YDI, New Day, Casa Q, Serenity Mesa. That's basically who we have. So, I mean, if there's more that we can do, let's do it.
When there are two hands.
Yes, thank you. I see Commissioner Quesada.
Thank you, Madam Chair. We just went over our budget, right? So I look at a difference between a 24-hour facility and a 12-hour facility is $300,000. For me, it's always about let's do things right and let's do things proper. Especially if we're looking at children that we're trying to give an opportunity to transfer back in, have opportunities to be successful. A lot of these kids will probably take night shifts, and it's kind of a bummer that if it was just a 12-hour at night and they're working at night and then also, some of the work that I was able to do through the gang intervention program that I did at YDI speaks to the fact that they can get in trouble during the day if they have nowhere to go, right? If we can't focus where they're at, or kind of control what's and have some control over what's happening, so it's kind of a half a program. I mean, we'll take what we get. I'm like you, I'll take what I could get. Our programs that I did weren't 24 hours either, but I think I could have been more successful if they had a place where, we could continue to keep doing that work. So, I think if we're really going to look at doing it, let's look at doing it right and trying to find the funding to do it right and do it to where, it's going to have a higher success rate. I'm also happy to see that it goes up to 25, because a lot of times, when they become 20 or 21, we think that's it, they should grow up or whatever. And as a man, I can tell you it took me to 44 to grow up. And so, and that ain't no lie. Unfortunately, that's not even a lie. But we want to make sure that we don't leave another gap out, right? So if we create one gap and create another gap, then we're not really following through with all the services that we can do. So that's my 2 cents. I like it. I know it's not capital, that's just operation money. I know we need a lot more money to have the facility. So we need, and so I think Commissioner O'Malley was right on the spot about, where do we team up? Where do we get these, this kind of funding to actually have the brick and mortar, right? Because, without that, whether it's 300,000 or 800,000 is irrelevant, right? If we don't have the space. So I just wanted to throw my 2 cents in on that. And really, I think it's a great, and thanks for the data. I know it's not easy to get data. People think it's easy to get data on kids, and it's not. They move quickly, they're in and out, they're hard to track. They're never in the same place, as from my experience. So it's tough. So I think the data you have is at least a good starting point. I think APS might have more data when it comes to some of the younger the students that are within their age range. I think probably have a lot more data. that they'd probably be willing to share with us to, you know, to make sure that we have more numbers. Because somehow some of these kids, and I don't know how, they still go to school and they still find their way, they still find a way to get back to school and go to school. And that's how APS is able to track those numbers. So maybe, you know, you could team up with that to get some more of that data. And that's what I got. So I've taken so long.
No apologies. This is what we're here for. Thank you. And then Board Member Cordova, and then we'll go to Dr. Zarai.
Yeah, so I was just curious about, because it sounds like there are some places that we have in the city, right, where we do meet some need, and it's unmet need around that. And what I was looking at in terms of just the familiarity with the other programs that we have that are currently there, none of them really seem to be kind of like that step down program, right? Where maybe you're in a shelter, but maybe the next step is actually learning how to live independently and to be in that apartment life and doing all of those things so that they can actually get on their feet and do that part next. When I was over at KC Family Programs when I worked in Texas, I know that one of the things that we had that was really successful, and it was in San Antonio, there was a purchase, and it was like, actually it was just like a donation of a 16-plex. I don't know how they got it, but they were able to do that and renovate it. And what ended up happening there is that it was kind of a step down piece. So if they were in the runaway shelter, they could go from there. They got some independence. They went back down and they went into the apartment living. And what was really nice about that is that all the case management and all the pieces too were also run by the young people themselves. So they had their own like homeowners association, their own council, and they pretty much set up the rules, the regs, everything that they wanted in terms of how it would be run. And then it was just really tied to like that peer-to-peer support. And then they also worked with a grandparents program that came in to offer some of that mentorship around grocery shopping, budgeting, and so on and so forth. So I'm wondering is like, wouldn't it be nice if that was a piece? Because I think we have a lot of young people that live in New Day or live in Casa Q, live in those places and need that next step, because they might be able to stay in that shelter, but then once the shelter time is done, there's like, that next step is just never, it doesn't seem like it's really there. Excuse me, I got something in my throat. But I was curious about that, if there was some thoughts given to it, sort of looking at it from that perspective as a next step.
Yes, what you're talking about is the exact thing we're talking about building out the continuum, because the service providers in our community, they know where the gaps are. They're very aware of the gaps, because you might be surprised, or maybe you wouldn't be, that the service providers are often sharing young people.
Yeah.
They're going to YDI, they're going to Casa Q, they're going to Serenity Mesa, and back again and back again. And so we are aware of what's missing in our community. And I love your suggestions about how to do those step downs, because there were more steps in 2015, but then our behavioral health system had a bit of a gutting. So we lost important steps that were very vital to the young people in our state, in our community, like group homes, transitional group homes for people that were in residential treatment, because from residential treatment centers to independent living, like transitional living, is a gigantic leap, and people do not totally gather how intensive a leap that is and how overwhelming that can be for a young person. So what we're really wanting to do is build out that continuum, figure out the appropriate steps, developmentally appropriate steps for these young people, so that we can really infuse the gaps with the proper support so they can continue their journey with hope.
Madam Chair, if I may.
Yes, Commissioner, is this in response to that?
Yeah.
Okay,
Just real quickly, just great to meet you, Member Cordova. I haven't got to meet you yet. Congratulations. I hope to get to meet you in person or one-on-one. But I just wanted to be clear that there are some of those programs are what are considered transitional living programs, that, and so like New Day has both a shelter and a transitional living program, and so does Casa. So there are a couple, but definitely not like enough to serve the need. I just want to make clear that there are a couple of transitional living programs that are that in between like shelter and independent living.
Thank you. Dr. Zarai?
Thank you so much. I just wanted to ask Quinn to elaborate on the need for a standalone separate youth shelter, separate from a large adult facility. Because again, addressing the issues, the developmental issues, the step down approach, to help us understand why that's important.
Yeah, thank you so much for that. So it is important to have a standalone young adult shelter, specifically for young people 18 to 25, not only because this is a gap, this is a crack that young people often fall through, because when they turn 18, the service delivery changes so intensely that there is often that miss. So young people will get lost in the shuffle of that. So that's one reason. But the second reason is that the young people in this age bracket will refuse to go to adult shelters. They won't go to the WEC. They just flat out will not. They will go once, they will never return. If you yourselves have not been there, you can go and then you will know why. So it is about having developmentally appropriate services for young people. It's different because I'm 36 years old. I'm going to have different needs than somebody that's 75 years old experiencing homelessness. It's just the truth. And best practice does dictate that young adult services really shouldn't be together with adult services just because they experience homelessness differently. And the point is to exit them instead of kind of get them kind of everything they need in the system. So that's the very basic version of why that's important. Thanks.
I would not have guessed you were 36. You look good. Okay, well, any other questions from the commission? I will say too that one of you just a moment ago, and it might have been you, Quinn, we lost a lot of steps in 2015. It's such a reoccurring comment to hear that. And to me, even though I know that in 2015, there were a whole bunch of good intentions, the fact that we can identify some of those steps that were lost, wouldn't it be amazing if we could just put back some of those steps? So I'm all for that. And I'm willing to help out with that wherever, because I wasn't a part of the losing steps and I didn't pay attention back then, but now I am. So I'm willing to step in. But thank you for that presentation. I think that this is really beneficial. This is the group that you all need to still be a part of and be talking to, because this is the key core group of people between the county and the city and APS. And when we're talking about youth homelessness, I think you have really good ears to listen to and very important people that can help out with that. So thank you again for being here. You're welcome to stay because we're going to talk about agenda item 4A. I see that Commissioner Piscotti is here now. So this is discussion separation of Department of Behavioral Health Services and Behavioral Health Initiative. Commissioner Piscotti and County Manager Julie Morges-Baca will be presenting.
Okay, yeah, I'll just introduce County Manager Julie by saying that at the beginning of this year, we had really a major development in our behavioral health services, separating out kind of our standing behavioral health programs from our behavioral health initiative programs. And so, I want County Manager Julie was the one who thought this through and made that happen. I know that there is also an element that is being worked on to align the criminal justice related behavioral health programs together into one kind of department that will focus on that, because, as we all know, behavioral health, homelessness, substance abuse is all, linked in with criminal justice issues. And so I'd love to have County Manager Julie talk about that, maybe touch a little bit on the role of the subcommittees at this point with the behavioral health initiative, I know last time we had some people, some chairs from subcommittees. I see some on now, and we were all excited to continue hearing from those subcommittee chairs. So I know that County Manager Julie met with all of you or most of you a few days ago. So I am just excited to present this to the board and to hear more about it if there's any updates on all of that. So take it away, Julie.
Thank you, Commissioner Piscotti. And so good evening, Madam Chair, councilors, commissioners, and board members. So it's good to see you all. Wish we could see each other in person. But I'm really glad to talk about this because I think that the city figured this out when they created their community public safety department. And so what everybody knows, this is no secret, that the cumulative impact of crime in our community, the root causes are drugs, substance abuse, behavioral health issues. And of course, this is all encompassed in our BHI initiative. And so, as you all know, and some of you may not know, so I actively serve on the Criminal Justice Coordinating Council. The Criminal Justice Initiative is one of the offices in the county manager's office. And so I've worked with them with both the BHI, Behavioral Health Initiative, Criminal Justice Initiative. And so there is this intersect between the two. And it wasn't just me, just so everybody knows, I never make decisions, and commissioners know this, never make decisions on my own. I have great staff to help guide me, and I have the support of our commissioners. So I ran this by them. And what I wanted to do is, as everybody knows, behavioral health has and we'll call it the Department of Behavioral Health. They run the CARES campus. They run the Resource Reentry Center, responsible for mobile crisis teams, the LEAD programs, the FACT programs. So it was, and also you all know about the initiative with the Crisis Triage Center with UNMH. So that is underway. We are working with the architect on the drawings for that. So we're making great progress with that. But then we have the BHI, which they are all our programs. They are all our committees that we desperately need to guide us through this process. So what we did is we basically took out the behavioral health initiative, and I brought them over here to Alvarado Square, and they actually will be having an office with our criminal justice, the criminal justice reform partners, so they can work together. And they can also work with our city's community public safety department. So we didn't add more staff. It is an office. It's not a department, but they're lean and mean. And I really feel strongly that they have a great relationship with the city's community public safety department. They work very, very well together, and with the behavioral health folks over at the city. So that's basically in a nutshell why we merged them together. And I think that they're doing some really good work, but I felt very, very strongly, and the staff that I worked with, and mostly the commissioners, they knew that this was something that we really desperately needed to do. Enough is enough. We need to address what's going on and what the root causes of crime are, and we need to work together with the city. So with that, yes, we do have some members of the steering committee and in the meeting, and it's good to see you all. We met, I thought we had a great meeting, and they had some concerns that I felt were really, really justified. And so one of their concerns is they felt like, they do so much work, they give so much of their time, and they want a voice. And so we're going to give them a voice. And so basically, they felt like they were just rubber stamping all these ideas that were coming from the county, and that's not what they should be doing. They are well-respected members in our community who give of their time, and I'm going to afford them that respect that they deserve by giving them a voice. And so we will have a plan that we'll be presenting to you all probably next time around, because we're all going to work on this together on how this is all going to work out with the subcommittees and the steering committees. So with that, I stand for questions, and we have, like I say, members of the steering committee. Thank you for joining us. We have Charlie. Charlie's here to answer any questions. So ask away if you'd like. Thank you very much, Madam Chair.
Thank you. I will say, I mean, I'm super excited too that this is where I asked a couple months ago, where is this subcommittee group? Who are these people? So I'm excited that in addition to them attending tonight, thank you so much. And I look forward to hearing from you in a little bit. In addition to that, you're saying you're giving them a voice and a tool to navigate and really manifest some of the decisions they're making. So I think that's good. Director Padilla.
Yes, thank you, Chair. But what I'd like to say is that County Manager Julie Morgas-Baca, thank you so much for doing this. The city has been working well with you, and the changes that are made are actually that's going to be good for the citizens of both Bernalillo County and the city of Albuquerque. So we appreciate all your work, and we thank you for doing what you're doing.
Commissioner Barboa.
Thank you, Madam Chair. Yeah, I just wanted to echo, I think, right, we have to keep being innovative. I think I've said before in this committee that I've attended a lot of those committees and hear that they need to both be talking to each other. They need to be talking to DFMO. They need to be telling stuff to us. So we're informed at this this intergovernmental committee. And I think I've already started to see it, and I really appreciated so far Charlie's leadership, Charlie Verplo, who's on right, to both listen. I think sometimes people just, like we're saying, they need a voice, and I feel like Charlie's done an excellent job at listening and letting them make some decisions about when they meet and how often they meet, and I think those are and then, you know, what they'll be able to make decisions about. And I've seen it already started. So I guess I'm excited about it. And I think that those pieces sometimes from attending the multiple committees, I've heard, right, that like some things that CJCC was working on really wasn't including some of the behavioral health stuff. And some of the behavioral health committees I'd go to were talking about the things that were happening at the CJCs, but they weren't connecting. So I think this just brings it together closer, and I'm excited for the opportunity. And really just wanted to recognize Charlie Verplo's leadership in this process that they sort of just got thrown into, or they're doing an excellent job.
Commissioner Piscotti.
Thanks. Yeah, I have two questions. The first one is that and I talked with Julie the other day about this, and so I just want to put this out in public. I had heard that there's this rumor going around that the behavioral health initiative is sitting on tons of money, millions of dollars of money, and we're not spending our money. And so it was my understanding that all of the money was spent or put in contracts, encumbered in some way. And so I was wondering, Julie, I know we talked about this. Could you address that, please? Because it seems like this rumor has just put on its running shoes and it's just running all over the place. So can you talk about that, please?
Absolutely, Madam Chair, Commissioner Piscotti. So the money that you're seeing is, as I told you, is we talked a little bit about the Crisis Triage Center. And as you all know, the county committed to $20 million towards building the Crisis Triage Center, as did the University of New Mexico Hospital. And honestly, I think that that's really a big step forward in establishing an amazing partnership with the University of New Mexico. And then also we have to think about the operating costs that go along with that. We have several contracts that were not, that it appeared that there's a lot of money in reserves, but that money, what we will be using is going to be for the tiny home village, which was anticipated. And I'd like to talk about that we're going to be talking about that in a few minutes. But a lot of that money too is tied up for the tiny home village. So most of it though is, Commissioner Piscotti, is for the Crisis Triage Center.
Okay, thanks for addressing that. And my second question, and we've talked about this before, some of the behavioral health programs that connect with criminal justice, like the RRC, the LEAD program, law enforcement assisted diversion, some of them are on the kind of the BHS side. And so is there a process to really kind of tighten up that alignment? Because as it stands now, it doesn't really align perfectly with the split of BHS versus BHI. So is there a strategy to really kind of tighten this up and bring them together so it really, really is effective?
And Madam Chair, Commissioner Piscotti, that's a good question, but actually, I mean, it should work perfectly because it's all under Bernalillo County. And so if county employees, if we can't work together, I really think that we do have a problem. So as county manager, it's my responsibility to make sure that, Margarita and her staff and Charlie and her staff work together. And so I'm happy to be the glue, but I should be, that keeps everything together. That's my job. And honestly, I really do it with a lot of pride because they have been working together. In the beginning, it's a little bit clumsy because it's new, but when you do new things and you try new initiatives, you take risks. And so you are a little clumsy, but we're going to get better at it. But my expectation is that the BHI and the DBHS, Department of Behavioral Health, work together because we're all one county, we're county employees.
Okay, so it's not just one split down the middle that totally separates BHS and BHI. It's that there's this third column, which is the nexus of behavioral health and criminal justice. And so that's both sides coming together, correct? Am I
Madam Chair, Commissioner Piscotti, that is absolutely correct. But also, it also ties in with the city of Albuquerque. They are our natural partners. And again, I'm going to say we have been working really well together with the Community Public Safety Department. So Ms. Pierce and her staff have been working very well with us. So like I say, it's kind of the same thing. If we can't work together, we are better together. So sometimes we're a little clumsy and sometimes, there's some wrinkles, but it's really, I'll just say as county manager, and I know that Sarita shares my sentiments, it's just really important that we work together. And so I'm in constant contact with Sarita to make sure that we all work together with all our partners.
Amen on that one. Thank you. Director Padilla.
Thank you, Chair. I'd like to just echo what she was saying, that the county manager was saying. We are working well together. The Community Safety Department, the new department that was set up, is working very closely with the county. The Family and Community Services is working very closely, and we think this is a positive step. We think we're going in a very good direction, and I would just like to thank you for all the work that you've done.
Thank you. And thank you, County Manager. Commissioner Piscotti, anybody else have questions or comments regarding this? Okay, well, thank you for that. I think that sorry. Commissioner Piscotti, go ahead.
Yeah, just a quick wrap up. I would love for BHI to really showcase their programs. BHI does so much stuff and kind of in line with where does the money go. I would love for people to know where the money goes because there's so many great programs that are being funded through the BHI. So thanks.
Commissioner, what do you recommend? What would be a good way to showcase it per se? Because I think that in addition to how you would love to share that, I also hear the rumor with the tenants like taking on their running shoes, where so many constituents reach out and say, where's all of our tax dollars going? We don't see any of this at work. And so I think that to showcase where the money is going, it would be beneficial, not just to really allow for proper and very justified bragging rights it would also be beneficial to the public to see and hear where the money is going. So, you know, where would that be recommended? I'll go on a roof. Just tell me which roof and I'll yell off of the top of it. But at the same time, I think that is something we should definitely work on.
Yeah, and I know BHI has been doing that we've had marketing and advertising campaigns, and they have a social media account. I follow you guys on Twitter, you know, to see what's going on with BHI. So I know it's hard to communicate things like this, but I guess just keep getting the word out there, you know, like the press conferences like that we had for the opening of the CARE campus and invited, you know, county commissioners, city councilors, Councilor Basan, I know you were there. So yeah, just keep showcasing what we're doing. Charlie, do you have any ideas?
Chair Basan, Commissioner Piscotti, thank you so much for bringing this up. It's actually something that we've been talking a lot and thinking a lot about, because it's always been the biggest critique, right, of BHI is that we're the best kept secret, right? And it's really important not to keep services a secret when people are really in need of them. So my plan is to get started with a marketing firm to be able to draft out like a marketing plan. And I think it would be really great to be able to show that if you guys are interested in kind of what the plan is related to how we do. One of the things in the gap analysis, one of the critiques of the BHI was that we do a lot of digital marketing, but we don't do a lot of in-person marketing. So it's hard for people who maybe don't have access to digital forums to be able to understand, you know, be able to be marketed to. So there's some other opportunities besides social, but I think, you know, social is one way, websites one way, you know, billboards and commercials, and I'd like to kind of do a variety of marketing. That said, we're also kind of in the works of putting together, it's so interesting, it's really an apt time to bring this up because we're working with County Manager Baca's Chief of Staff to put together some ideas around some kind of platform or forum on the website that'll be able to show you exactly what money is going where. And I think that would be real helpful because then it's like you can really see where it's being allocated, right? It's one thing for me to say all the money, 98% of the behavioral health initiative dollars are allocated, but it's another thing to see it broken out by the different contracts. And then that's really great because you can click on it and go to that provider's website and learn about what they do. And also want to put something on the website that's like a get help page so people can link to particular services that they need. So got a lot of ideas, and we'll be moving forward with that and keep you guys updated on how I'm doing.
Great. And I just want to add, not only am I a mental health therapist, but I also have a background in advertising and marketing. So right now I'm going to put in a plug for my own event, which is next week, Thursday at Los Vecinos. I'm having a veterans outreach. And I know that there will be people from our behavioral health services there because we do support veteran services, behavioral health and housing services. So that's probably a well-kept secret. So now everybody knows that we do support veterans.
Wonderful. Thank you, Commissioner, and thank you, Charlie. Commissioner Quesada.
Thank you, Madam Chair. And yeah, I think it's extremely important for us to get information out. I think it's always been one of our biggest challenges, even if it's just the services that we provide for Bernalillo County. And so I just wanted to share this with you all. I went to a workshop, and it was a press workshop when I was first elected, and they had people from the press, and they opened up this whole workshop by saying, first thing we want to let you know is we're not your friends. We're not here to put out in the media all the good stuff that you do as an elected official. We expect you to do that. The only thing we like to put out is the things that you're not doing. We only want the bad news, right? We only want to put out that kind of press because that's what draws people back to watch the station. That's what, as you know, that's what's kind of really divided this country. It's not really us who maybe differ by a percentage, but it's in the media, it's this big thing that they sell. So with that being said, it's really up to us. And we do have the avenues to go, now we have the avenues to go around the press, right? We have social media. I think it is a smart idea to work with an advertising firm on many different levels, but mostly through social media, because you know how rumors are in New Mexico. You could always tell if it was a rumor because I started it. And that's just the way New Mexico has always kind of worked. And we've never had the avenue to kind of crush that kind of, stuff that goes out into the community. But now we really have, an opportunity to do that through social media and through firms that do that kind of outreach. And I think we need to start looking at that. That's the only way we really can be transparent. Because again, I'm going to tell you, the media, they'll do one good story, one good news story out of 50 bad ones, right? And so it depends on that day and how many stories they have that day. And they may show up to your event when you're doing a ribbon cutting or you're showing some of the great things you do, but they don't make a big story about it. You'll be lucky if it's a blurb or if they just say, oh, we don't have time for that story because this person got shot or there's crime over here. And, so I just want us to all be aware that we can't rely on press, that we have to rely on ourselves to get information out. It's hard, it's difficult. Like I said, just even providing services to people in the South Valley, people don't leave the South Valley. They don't want to go anywhere else. But they don't know where to get the information. So that's always been one of the hardest things for me as their county commissioner, is to get them the information. We do have the services. We do have the things. We put a lot of money into it. Here they are. And the only way they know that is if they individually reach out to my office or reach out to Bernalillo County. So I think not only for behavioral health, but just as government as a whole, we need to start getting out the good things, the positive things that we do every single day, because it doesn't get out into the public. And we need to do better. But it's hard because we only have a limited amount of budget that we got to work with, and we want to do programs with it. We don't want to have to advertise with it. But if they don't know about it, then are we spending the money the right way? I don't know. We could probably debate that for a while, but I think that that's got to be part of what we kind of put into our budgets to make sure that the public knows what we're doing. So, and I think those are all good points. And that's why I wanted to throw my 2 cents in on that.
So Commissioner, let's pick which roofs. I'll meet you and we can go to roofs together, and then you can come up here and we'll do roofs over here, and we'll just tag team it, because I think it's definitely worth it.
I'm ready to do a TikTok. I'm ready to do like a TikTok.
Well, I can't wait to see that. And for the record, for some people, they don't have the ability to get on social media or websites, which I know was discussed. But then there's people like me who has completely intentionally abandoned social media 100%. So although I have accounts, I do not ever go on them and check them. So that is, I don't ever hear about it if it's there. And I even have the means, I just choose not to use them. So it's, again, so many varieties of stories that I think are important to really, so I still stand by my roof comment. Okay, so thank you for that. And we are going to go to old business. And this is item A, is continuing the Behavioral Health Initiative update with Ms. Verplu again. So if you want to go ahead and continue that and speak to us a little bit about the tiny home funding proposal.
Sure, absolutely. Thank you, Chair Bassan, and good to see everybody this evening. Thanks for giving me an opportunity to give you guys a short update on some of the things going on in the BHI. So I wrote out a couple of notes for you guys, and if you have other questions on other things that you want to hear about, happy to talk about them. The first thing that I wanted to update on was our living room model program that's going to be out in Harris. So we found a location. We're in the process of completing a lease with the landlords there, and we're working on a contract with a behavioral health provider, hoping to finish that by the end of the month. And the expectation is to have services up and going by the end of May. So really excited about that. That's a peer program, kind of like a drop-in model that was talked about earlier this evening. And they'll be there with some clinical oversight to provide services for people before or maybe after they've been in behavioral health crisis. We also have a temporary hotel shelter that's at the Days Inn Hotel. And that shelter is actually going to be closing mid-April. It's been running since January. It's been full ever since the beginning of January, with the 50 units completely full, and then an average about 70 clients every day. So they have individuals in each room, but then those individuals came with family and children there at that hotel. So really lucky that our county advocated for that and was able to get some individuals out of the cold for the winter months. A little bit about the tiny home village, and you guys are going to hear a bunch about this in here just a minute, so I'm not going to go into too much detail, but a quick update on what's going on with that program. We're working on a long-term contract with an organization called OCH, or Office of Community Health. They're with the University of New Mexico, and so we're getting a long-term contract with them. We've got a really short-term contract with them right now to bring in just a few services. There are actually clients at the tiny home village, so I want to make sure that they're protected, safe, have the services that they need to get connected to long-term stabilizing services, and also to be able to develop out the program. So intake criteria, screening, referral, discharge papers, all of the process and the paperwork that's involved with putting the services there, want them to get started on that so that when we're ready to go and we have the funding ready to go, that they can hit the ground running there at the village. We've been working with the community forum to identify some changes in the eligibility criteria and the application process. Not really significant, but just really wanted to make sure that everything was in place and ready to go when we started reviewing applications. That should be finalized by the end of this month. And then the team over at the Tiny Home Village is going to start reviewing the 60 applications that are currently in the queue. So they'll review all those applications, they'll update them with clients, and then they can start bringing clients into the Tiny Home Village. And I know that's something that we've all been waiting a really long time for, and wanted to make sure, with it being a challenge in the beginning, really wanted to make sure that we had all of our T's crossed and I's dotted to make sure that we had everything that we needed there and are successful this second time around. 2.0 Tiny Home Village. We are doing a joint strategic plan with the city. So we talked some about our good relationship with the city and that we're working together on.
Because if we don't abide by the rules and something does happen, then we're going to be in a situation where then what? What if somebody gets hurt? What if somebody gets stabbed? What if somebody gets shot? We don't know what could happen. You know, we're talking about substance abuse. We don't know how much substance they've had. We don't know how much alcohol they've had. But if you can detect it, then at that point, they shouldn't be allowed in.
Yeah, so I'll let Carolyn, if you'd like to speak, or Commissioner Barboa.
Commissioner Barboa, would you like to start? I can.
Go ahead, Ms. Chavez.
Thank you all. I just wanted to point out that what we have made adjustments around is not necessarily that we are completely removing the rules around substance use and alcohol and all of those things. So those things, there will still be rules, there will still be guidelines in place, and there will still be accountability and all of those things. We had a really high barrier to entry with that in the beginning, with the 30 days clean requirement there. And so it's a lot for people to do. So what we're trying to do is to design a program where we meet people where they are and then help them toward harm reduction, toward recovery based on their goals. But that is still a requirement of the program, that they're still looking to do that for those who that is an issue for them. Obviously there's many people who that is not an issue, but that is still.
Okay, what's the criteria that has changed then?
The 30-day requirement at this point is that they wouldn't have to have that 30-day.
Okay, why didn't we bring this up way early on in this conversation? Because that's, to me, if you're going to send it back to committee and then move back and then want us to work on this, that should have been one of the first things that brought up and discussed, in my opinion.
So Councilor Sanchez, I think maybe Commissioner Barboa might be able to help with answering some of that. Commissioner?
Yeah, thank you. First I want to say that I continually to be amazed at how much harm reduction model, which has been around successfully since the 80s, still continues to be talked about as taboo or scary. It's proven, right? And I would love for this commission to understand the landscape that we're dealing with, right? We have groups that, and all of us, city and county alike, fund almost all these programs that take, and we need multiple approaches. This is not, there's as many different needs in every individual out there. So we have programs like Endorphin Power Company that are strictly sober living that use endorphins. They don't even talk about alternatives to, you know, they're talking about your own body, your own sober living. They want to create community movie nights for sober folks, coffee cafes, because there's nowhere else for folks that are living sober to really go in and have a good night out without alcohol and drugs being present, right? So there's programs like the CARES campus that have its own limitations. We've heard enough about the new limitations that are going to happen and barriers into, or, you know, low barrier, high barrier access to all that at the Gateway Center, at the WEC. Like we need to be taking multiple approaches. So the fact that Tiny Home Village, the way I like to explain it most for everyone to understand, right, is that it's not that we're encouraging. In fact, we brought together providers, and that's the part that I think's been missing, right? People who do this on the ground every day, that have been running transitional living programs for decades, and brought those folks together to develop what is the niche that Tiny Home is, the gap that's filling, right? And when we think about those folks that we see on the streets, you and I, Counselor, talked about this in that meeting, right? We know that there's people are doing drugs right there in their tents, right? And so how do we then provide a space for folks who are ready to have a safe place to rest their head, and hopefully consider making moves towards self-determination? And this has to be a community, right? Everybody that is applying for that, that's the first thing they have to agree to, is to living in a community where people are trying to self-determine a better life for themselves. And that's why it's going to include skills development programs, counseling if they need it, rehab if they need it. Charlie's already talking about, if somebody's ready for detox and wants to come clean today, how do we get them directly into the CARES campus? So, but the point is that people can't get in there and actually have a safe space to rest their head and even consider sober living until they have that safe space. That's what we talk about. We're saying like that we want them to have that safe space to rest their head to consider.
But you didn't answer the question. The
I'm going to
question that
answer
I
in a
asked.
second. So now people that I'm going to answer, I'm sorry, I'm a storyteller. So now when people get in there, and really it's not for this committee to decide. Your question about whether we brought it up later or earlier, you know, it's the behavioral health program right now is being run by the county. So, and that this committee doesn't make decisions on operations, right? But when we bring providers together with their expertise, they said, yes, this needs to be a place where people are moving towards that self-determination. We don't require folks to take a drug test. We're not going to go into their personal homes and do drug searches. But if there's behavior that is harmful, that breaks those agreements about living in community, working towards better living and self-determination, if there's behaviors that are harmful, that is the reasons why people get kicked out. So if they're acting
Well, what about
harmful,
before they even?
Hang on, Counselor Sanchez, if you'll let her finish, please. Counselor Sanchez, we'll circle back.
If they're acting harmful in any way, they can be kicked out, whether it's because they're using drugs or alcohol or because they're a complete asshole. If they're acting harmful in any way, that's the reason why they get reprimanded, not because they possibly are using or not.
Counselor, I know you have some more questions about this, but if you don't mind, I'd like to go. I have Director Padilla with his hand up, Commissioner O'Malley, and then I'll come back. So that way, in case they have something that may answer your questions or whatnot, I would like to do that. So,
okay,
Director,
that's fine.
Thank you, Counselor.
Thank you. What I'd like to, I think that it's important is for people to understand that there's different types of programs for different types of needs. So what we're trying to do at the Gateway Center is we need a place for somebody to go, regardless if they're on a substance, if they're on anything. And that's what we're trying to build at the Gateway. So when somebody goes to the Gateway Center, what we want to build in the future is it says that anybody can go there 24/7, regardless of what is happening. If they're mental, like there's mental problems or mental illness, or if they're addicted, if they're on drugs, they're on anything, that we need a place for people to go. That's what we're trying to do with the Gateway. What the Tiny Home Village is a place for people to go after they've entered into a space like that, been able to get clean, and been able to start go down a path of sobriety or other things. So it's important to look at the entire system as a continuum. And what we're missing is a place for people to go who are actually 24/7. If you're addicted or if you're on a drug or if you're on alcohol, where can we take these individuals? And Councillor Bassan has actually come up with an idea where she wants to help address this. She calls it land. Her and I have talked about it, but it's a place like you come to the Gateway Center, then from there it's the next step, then it's a next step. And it's important to understand that what they're trying to do at the village is try to address the needs of individuals are at the space where they're at. But what we need to do is fill the gaps. And the gaps are, where do we take people who are on a substance, who are suffering from mental illness and on a substance? In the last meeting, we heard Commissioner Quesada. He talked about the gaps that were there and his nephew. And it was heartbreaking to hear what he had to say. And it was somebody who actually came off of substances, and they took him to a place and they turned him away because he was no longer on those substances. So when we're looking at this, we need to look at the continuum of care. We need to look at all the gaps that are there so that we can actually help people and we can improve our city and we can help the residents of the city of Albuquerque and Bernalillo County. So identifying one particular piece of the puzzle and saying that they're missing out on something doesn't understand that we're missing gaps to get them to this particular place. And I think it's important. I think at some point in the future, what we need to do is describe the continuum of care from entering a place like the Gateway Center, which isn't even built yet. And then from there, how do we transition people so that they can get help? Thank you.
Thank you, Director. By the way, anyway, I'm going to talk about that later anyway. Commissioner O'Malley, and then Director Verplu after that.
Thank you, Madam Chair. As you can imagine, and I think people remember this, it took a year of planning and 2 years to find a location for the tiny home village. And why was that? Well, because folks didn't want people in their neighborhood. They didn't want people served in their neighborhood. It's like, this is something we need to do, but not in my neighborhood. And so fortunately, we were able to find a site. And it wasn't just because we found the site, which of course I appreciate the Albuquerque Union Center for coming forward. We had to get the neighborhood behind it because there was a zone change. There was a lot of work to do this. I think it's a shame that this is pretty much all we can say that we have, right? So everything is like, well, the tiny home village is supposed to take care of all the homelessness situation in the city of Albuquerque. Well, I mean, we don't have a lot. We have shelter, we have this, and it was created in a certain way. It was built a certain way, and it requires that people do interact with one another. It's supposed to build social skills because people are traumatized. That's what it's supposed to do. I have no expertise in this field. My background is in development, right? I've done affordable housing. It's very different to do affordable housing, get people in affordable housing, than it is to deal with people who are traumatized and on the street. That's not my bailiwick at all, which is why it was important that, thank goodness, we had some other folks understand this. Commissioner Barboa has some experience in this area, so does other folks who are working with us to get this underway. But it's not a perfect system. Okay, we have folks who are coming from us with all kinds of situations. I just said, we have people in the situation with drugs and alcoholism, etc., that are housed, and we know those people. They're fortunate that they have a house. And then we have the same population, but they're unhoused, which makes it even more difficult, and they're even more traumatized. So how do we deal with that? My feeling is, I just say go. Folks who are working on this, who have the expertise, they are committed to creating a safe, secure place. Maybe they've changed the entry a little bit, but they're still behavior based. It's still They're still required, people are just required to behave and that sort of thing. I think that's what's important. And that's important because that's what we told the neighborhood we were going to do. We were going to create a place that people could be proud of. It's well designed. It's basically now solar operated, which is great. We got a grant from the state to do that. Made an efficient building as much as possible, created a beautiful space for people that the neighbor could be proud of and people in the village could be proud of. Now comes the operations. Quite frankly, we were naive. And I was one of those people at the beginning saying, oh, we don't really need that many people to operate. Oh, we were wrong. So, but it takes time, right? They have to evaluate the entry criteria and really delve into it. And then I'll just be honest with you, as a county, it takes a while for us to hire anybody, whether we have the funding or not. It takes a long time to hire people. But people are moving forward and they have my full support. I'm not involved in the details. I mean, as I said, I was very involved in getting it underway, as people know. And I take full responsibility too for, that I was naive to. I wish that I had more information at the beginning and that we had staffed up right away. We didn't do it. Okay. Now we got to do it. So, I think that we're on the right track. That's all I wanted to say.
Thank you, Commissioner. And, the county's not the only one that takes a long time to hire. It's not just one side of this that's the same. We're struggling with that everywhere and in the city as well. So Director Verplu, I don't know if you want to actually allow Mr. Barndollar. I know you had called on him at the very beginning of all of this as well. And then we'll come back to Councilor Sanchez after both of you.
Sure, I think I can go pretty quickly. I just wanted to respond really quickly that I think that we were unrealistic in some ways about the entrance criteria in the beginning, and it was one of the reasons why they had a really difficult time getting enough people that could meet the criteria to be able to stay in a tiny home. And so want to bring it down to a level that's reasonable with the clear understanding that there has to be rules and expectations of people that live there. And we'll be very careful and thoughtful about that. People who are running this have a lot of experience, both in the medical and behavioral health field. So if someone comes in and they're going to be detoxing, they need medical detox or a social detox, we'll make sure that that happens before they get put in the tiny home. And I guess the other thing I'll mention is that if you go down to that area, there's a lot of people living on the streets in that community, just right on the sidewalks there by the tiny home. So this is already existing. This happens already outside of the walls of the tiny home. And so what we're doing is bringing it into that space, providing a little extra support and resources to help people be successful into getting into long-term stable housing. So I hope it's successful. Thank you for the questions. I did want to turn it over to our chair, Michael Barndollar. He is the chair of the Housing Committee. And actually, I had thought that he would start the conversation with just kind of telling us what the proposal is all about and what the funding is. But I think we've talked about some of that. So I'll let you kind of talk about some of your pieces or anything related to what the subcommittee talked about and just let you guys chat a little bit about that process.
And Chair Barndollar, thank you. And before you get started, I don't know if this would be better for you to go ahead and continue or if we should circle back. I did promise Councilor Sanchez we would circle up to wrap up that part of the conversation. So I don't know if you're going to be adding to this specific part or if you want to go in just a moment.
I can go in just a moment. That would be perfectly fine, Chair Bassan.
Okay, thank you so much. So Councilor Sanchez, I told you we'd circle back if you have any additional comments or questions.
Yeah, the only comment I have is that to tell you the honest truth, it just doesn't seem like everything was up front to me. But the comment that I want to make is that I come from a background in law enforcement. I'm out in the streets. I was out in the streets every single day for 26 years. I saw the homeless issue when in Albuquerque for many years. And one of the things that I've seen more than anything is I've seen and heard the same comments over and over and over and over for 26 years. And the same comment is, we need more money. We're in a serious crisis. We need to start this program. We need to start that program. But 26 years later, I still see it getting worse. And if you get right down to the nitty gritty, who are the greatest survivors who are the greatest survivors out here? The greatest survivors out on the streets are the individuals who have mental illness and severe mental illness. They find a way to have water. They find a way to survive. They find a way to find warmth. They find a way to do everything, including their drug use and their abuse and their abuse of the system. You know, 90% of the time when you were out here doing this, I'll tell you right now, I could not live in that environment, as every single person that's listening could not live in that environment. You couldn't live in an environment that has to deal with drug dealing every day, that deals with extortion every day, that deals with violent crime every day that's never reported. All of those things are going on. And those are the things that need to be dealt with up front. The drug abuse, the things that are happening, and mostly the criminal activity. And that's what I see more than anything. I see it every single day in front of my office. I see these individuals, they live in a small tent right across the street from my office, and the guy pops out early in the morning, and the first thing he does is go crush his fentanyl pill so that he can stay high. And then the next thing that happens is everybody else that is supposedly homeless is doing the same thing. There's a massive drug ordeal going on out there in front of my office. People get stabbed. People are involved in fights. They're throwing rocks at each other. They're yelling and screaming at each other. I honestly see the very, very basics as being a major crime issue. And not only are they, if you go into any of these homeless communities, there's a hierarchy in every single one. And I know for a fact because the community here at Coronado Park has a hierarchy. If you go over there, you can see, you can find out who the boss is. You can find out who his commanders are underneath and the whole chain of command all the way down. And if you cross that individual, you're in trouble. You are in deep trouble. So, I'm just saying what I've seen for many, many years. Maybe I'm not the right guy to be involved in this committee, but I am going to speak the truth of what I see and what I've dealt with for 26 years in the law enforcement field and being out there. And not only that, the hours and the time of training that we have for dealing with any mentally ill individual. And that's in the face on the job training when you're out there, and then you're doing the inside training. So a law enforcement officer probably has more on the job training in these kinds of fields than most everybody. But we're ignoring the fact that there's a major crime issue going on out there within this community. You have unreported crimes all the time. And the last thing you want to have is you want to have somebody that walks into these places that is intoxicated, that's on drugs, that's got a handful of drugs in their pocket. And then all of a sudden you have a bigger problem when you're in there. And like I said before, the greatest survivors survived way better than I do. And it's all of the folks that are out there on the streets who are doing all their illegal activity and hurting each other. And that's the issue that we need to really concentrate on, in my opinion. I'm sorry, that's my rant.
No problem. Thank you, Councilor Sanchez. I'm going to allow Ms. Chavez to say something, and then we're going to move on to Mr. Bernalillo.
This is just a really quick comment that I just thought of while we were speaking there, is just to point out the need for this funding. We had very high standards for the first group of folks that moved in. Like, they had to meet that 30-day clean and sober requirement and all of those things. And we've still had issues with people who come in and then we realize they had severe psychiatric issues. So they've relapsed. We've had several folks relapse. So really what we're trying to do is to put the support in place to be able to handle that. It's going to come either way, regardless of what the requirement is. So we just want to make sure that we have the support in the system set up so that way we can handle those needs as they come. So.
Thank you, Ms. Chavez. So Mr. Barndollar, thank you for your patience.
Oh, my pleasure. Good evening, Chair Bassan and members of the Commission. County Manager Morgus Baca and Director of Plu have basically stolen all of my thunder. So I will just make a couple of comments. One is the volunteers of the BHI committee have had exactly the same discussion. And we've had it for months in subcommittee meetings and steering committee meetings. A number of the county commissioners have participated in those meetings. We've had special meetings. So when we bring this proposal to you for the $500,000 for staffing, it's not that we haven't had the same conversation and come to some of the same conclusions. I do want to point out that one of the critical issues, and there's a ton of research behind this, and the Substance Abuse and Mental Health Services Administration of the federal government supports what they call the housing first model. And even though the tiny homes village is not a housing first model per se, what the basic research says is that when a person is safe and secure in some kind of housing, even if it's transitional housing, they have a far, far better likelihood of success in making progress to the next step in their journey, whatever that journey may be. So the reason that my subcommittee in housing and the steering committee went through this, knowing that there's some flexibility and some changes in the criteria for admission, maybe closer to a housing first model, but not a pure housing first model, because then you could come in with anything at any time, which is basically what the Gateway Center is going to be. We feel comfortable bringing this proposal to you tonight for the additional $500,000 to run the program. The other subcommittee chairs, I believe, are all here. If any of them have an opportunity and want to share, feel free. I was going to open it up for questions, but I think we've had enough dialogue already tonight to move forward. So I'll end my comments there. Actually, I do want to say one more thing, and that is I do want to thank County Manager Morgus Baca. She mentioned that she met with the steering committee, with the chairs of the BHI earlier this week. Not only did she listen, she heard. And as she mentioned, we're going to be working together to really move forward with the BHI to be able to take on more things, do more things, bring more things before you, so that we can begin to solve even more of the crises and some of the things, for instance, that Councilor Sanchez is talking about. So we'll be back. Thank you.
Thank you. And Director Verplu, do you want to introduce? We'll move on to subcommittee reports unless there's more about the tiny home funding. I feel like they're kind of weaving together anyway. So if we want to incorporate that as well, I'd be happy to. Charlie, do you want to introduce the next step, please?
I would be happy to. So we have our 4 chairs.
Sorry, Commissioner Quesada.
No, I just wanted to make a quick comment that, I understand what Councilor Sanchez sees as a police officer on the street. He's actually seeing people who aren't going to services, who don't think that they are, that they don't feel like they need any help or whatever. And that's definitely a problem too. I think what we're trying to address is the people who are willing or trying to change their life and look at what kind of rules are in place to get them to that point. I heard him. I understand him. I didn't spend 20 years watching, and seeing the things he saw on a daily basis. I don't think any of us do. But I'm just going to say that when I was doing the gang intervention programs, my kids would make mistakes. There was many times I would have to go in front of the judge and advocate for my kids because they found them with a joint or they found them drinking. The one thing I would not do is I wouldn't stand with them if they committed a violent crime. But if they come on, they caught them with a joint and they're going to kick them out of school and they're going to ruin the kid's life. And I think that I just because I have the experience of dealing with drug addiction in my family, my nephew that I had talked about last time, he spent 30 years denying it, right, and not asking for help and not wanting help. And I get that. And that's what our police officers have to deal with on a daily basis. But I think what we're trying to do here is trying to fix for those who are at a point, because eventually he got to a point, right, where he had finally realized that it was on him and that he needed to make a change for himself to better his life. That's what we're trying to focus on right here, I think, with these programs. And it's not really about, and so my opinion was, and so when I started this conversation last meeting about the rules and regulations, what I meant is that something has to give, something has to change, because we got to meet them where they're at, because I feel like he probably does, that it's not working at the level that we want it to be working. And so I thought maybe that would be, something we can look at, is what are our policies, what is the criteria to get them through this. And I also did in my statement last time say every individual is different. You can't get one paintbrush and paint across behavioral health and think that it's going to fix, because it's the same quagmire as education, right? Not one brush deals with each student individually. They're all different. And so is dealing with behavioral health, addiction, and mental health, problems in our society. So I just wanted to make that statement that, understand what he saw and what he sees. And I just want to clarify what I was trying to make a point on the last meeting about, looking at, sometimes you have to be forgiving depending on what it is, right? And depending on what they did changes, that perspective. But they're drug addicts. They're going to fall off the wagon. They're going to mess up. They're going to make mistakes. They've done it for years. Do we just throw them back out on the street and we'll go back, and so they go back to their tent? Or do we try to figure out how do we meet them halfway? So that's all I was saying last meeting, and I know that's why it turned into this conversation for this meeting. I just want to clarify what I meant. Maybe I just didn't state it correctly. I have that problem sometime of stating myself correctly. Just wanted to clarify that, Madam Chair. Thank you very much.
Thank you. All right, Charlie.
Okay, so we're lucky to have all of our 4 chairs from the Behavioral Health Initiative subcommittees here tonight, and those chairs are on the steering committee as well. So our steering committee chair is Catherine Reeves, and she's also the chair of the Prevention, Intervention, and Harm Reduction subcommittee. We have Michael Barndollar. He's the vice chair of the steering committee, and he's the chair of the housing subcommittee. We have Cynthia Sontag. She's the chair of the Crisis Subcommittee. And we also have Manny Crespin, who's the chair of the Community Support Subcommittee. So we're glad to have them here. And I think we can turn it over to them if they have comments. I was hoping that they would talk some about the conversation with the county manager and our thoughts about our next steps with the Behavioral Health Initiative subcommittees and how to help them to be more effective and maybe some of the changes we want to make. So I'll turn it over to them and let you guys share.
I'll jump in. I'm Cynthia Sontag. I'm a clinical social worker and I'm the chair for the Crisis Subcommittee. We are currently working on developing what our role is in this second phase of the behavioral health continuum. And at our last meeting, we just started to throw out some ideas of things we thought that were very important, and we brought them up with the county manager at our last meeting. Huge for me on all the committees I've ever been on is communication among and between the various subcommittees as well as the public and with you. So we're going to be working on how to do that. Also, continuum of care, because that's so important. People come in crisis and we don't want them to stay in crisis. And that means they have to move on to another program, another situation. And to me, the third that's really important, but I've talked to some of the committee members, is looking at what the gaps in services are that are within what they're providing for services, so they can boost what they have without having to start new programs or, get more money or whatever. It's like, what supports do these services we are already doing, what can we do to suggest to make services more robust for them with what they already have, and continue to support them in their progress.
Thank you. Chair Sontag, thank you for that and for being here. It's nice to meet you. Chair Reeves, or I don't know if Chair Crespin is still with us.
Hi there. I can jump in. Thank you, Madam Chair, and the rest of the committee, and especially for letting us come and join these meetings. It really means a lot. I've been the chair of the Prevention, Intervention, and Harm Reduction Committee for about 3.5 years now. So I've seen it change, quite a bit. And I can say that I'm extremely excited about the direction it's going. We have a lot of support from not only Julie, but Charlie, and it's great. Our committee in particular has seen a little bit of turnover recently, but we're very excited to report that we have 4 new committee members, and they will start joining us in April, so we can start moving forward and really, sharing that voice that all of our committees have wanted to have for a long time. And so thank you for having us here. I don't have any other updates other than that, because we are still working on that restructure piece and figuring out, where we're all fitting, and then of course growing our individual committees as well. So thank you for having us.
Thank you. And absolutely, you're always invited. You've been on the agenda in the last 2 years that I've been on this commission, and I'm glad you're here. So thank you. Chair Barndollar, do you have anything else that you want to add?
I just want to add, I just got a text from Chair Crespin, who wanted me to say he had to go to another meeting, but it was like everybody else, all the other chairs who said, thank you for inviting us, having us here on a regular basis. We want to participate with you actively. And so he wanted me to just relay that.
Thank you. We definitely, I think, are going to benefit from updates and perhaps attend some of the other meetings that you all have with your steering committee and committees. Okay, so is there any other business tonight? Okay, I'm really sorry to do this to you, but I do have some things I want to add as other business. I promise I'll try to make it really quick. I would love, Charlie, to hear or have you all come back with an update. You had mentioned, you're working on a marketing plan that you'd be happy to share. So, when you have that and you feel like sharing, please let us know, because we'd be happy to put it on the agenda so that we can all be included in that and help out where we can, as far as shouting from whatever rooftop it may look like. I do have a question of the commission, and I realize that this is something I could send out in an email, but while we're here, I'd really like to ask you 2 things. One, does the subcommittee mind waiting till the end of the agenda to give the updates, or would you rather be at the beginning? So that way we can get updates from subcommittees earlier on, rather than that way you don't have to sit through all of the other new business if you might have other meetings. So I guess subcommittee members, do you have a preference?
Chair Bassan, I certainly wouldn't mind.
I am fine either way.
Yeah. Okay. All right. So we'll work on that. And then for the rest of the commission, do you prefer, so we're not having a meeting in April due to some of the budget council meetings that we have in April. So we're coming back in May. I'm curious, do any of you, I realize that Zoom is super convenient. I'm not going to lie. I agree. It's very convenient. However, I also think that in person is very professional and sometimes changes the dynamic of things. So is there a strong opinion about Zoom versus in person? Or send me an email if you'd prefer. So please, I guess, to you all, reach out and send me an email to let me know what you would prefer for the May ABCGC meeting. 2 positive things. Commissioner O'Malley, you were talking about some positive things earlier and you had mentioned that. So 2 positive things that I would like to add to the agenda in May. I know that with Commissioner Piscotti and myself and some of the board members, we were starting to talk about the opioid settlements and really trying to work together. I think that this, this stemmed from our conversations here. I look forward to still having some meetings as a subcommittee where we can talk a little bit more casually about it, but I wouldn't mind also bringing that into some of the agenda topics here where we're allowed to do so legally. Like, I don't want to break any rules when it comes to any of the settlements or whatnot, but I think that would be good to add to the agenda. And then my last thing I would like to tell you about, Director Padilla had kind of mentioned it earlier. It's not like any genius idea that I've had all to myself. He called it land. I typically call it dirt, but land is probably more appropriate. And I think it is very valid when it comes to the entire conversation that we've had tonight. Whether it be something like the Gateway Center, which we keep hearing about, but to me, it's almost like a panacea at this point. That's like so beautifully perfect that it's like a nirvana of sorts. And I don't know how long it's going to take for us to really get to that vision. And then you have somewhere like tiny homes, and then we have the West Side, And then we have the different nonprofits. And now, we're talking about all of these things, and then there's some other counselors and myself, we're looking into trying to do safe outdoor spaces, which is really working on beginning something very similar or even identical to Camp Hope in Las Cruces. All of these, I think, are very doable. They're all fabulous. We have the CARES campus. I'm not trying to leave any of that out with everything, but these are all parts of it. And we've talked about this. So my idea of land, again, it's not, I'm not trying to say it's mine, but I really am severely activated and prioritizing it. We have to start somewhere. And I don't think we're starting somewhere. I almost think that we're starting at the end products. And I don't mean any disrespect to anybody on this, because I know there's a lot of hard work, but we're almost starting at end products. Right now, I want to identify land in Albuquerque, in Bernalillo County. I think ideally in all 9 council districts. This does not fall into the not in my backyard category, personally. I mean, but I realize that people are not going to be happy with this solution. However, the argument is people aren't happy now. People aren't happy looking outside their business windows and seeing the things happening, or going to work and having people camped on their property or in their yard or at our city parks or our county parks and such. So this is not about necessarily making sure that we do this without offending people. But if we can identify land that we already own, say you can do this, you can still live in your tent, you can still do what you're doing, you just can't do it anywhere. You have to pick one of these locations. And that's the very first step. And I mean that so sincerely, because then we can get the Charlies and the Albuquerque Community Safety Departments and all of the subcommittees and all the nonprofits to go and figure out how to identify the people that want to go into the tiny homes or the people that need different services. And then we can have the different law enforcement go by and do the very idea of what community policing is about. So I just want to give you the plug that this is my newest, biggest, strongest mission is land/dirt. /dirt. So I'm working on that. It's not to say I want to warehouse people or hide people or ship people off or anything. I'm not trying to demean any of that. I'm trying to keep it very simple so that we can say our families can go to parks and our businesses where there is some kind of expectation, but people still have a choice to continue doing what they're doing as long as it's not harming other people. And that's going into, I think, all of the conversation that we've had tonight. And I felt like it was very valid to share that with all of you. Feel free to email me with your support of it. But if you don't like it, go ahead and email me too. But let's talk about it. And I think that would be something that we could work on together as well. So last bit of business. Thank you for listening to me. Agenda item 7 is our next meeting. It will be on May 26th at 5 p.m. The location or virtual setting is to be determined. Item A under next meeting is our upcoming subcommittee meetings. For those of you interested in participating in any of those that we've heard about tonight and that are really, I think, going to become even more strongly activated. The next community supports meeting is Tuesday, April 12th at 5:30 p.m. via Zoom. The next prevention, intervention, and harm reduction meeting is April 13th at 3 p.m. via Zoom. The next housing supports meeting is April 14th at 5:30 p.m. via Zoom. The next crisis services meeting is April 20th at 2 p.m. via Zoom. The next steering committee meeting is April 21st at 3 p.m. via Zoom. And the next addiction treatment advisory board meeting is April 18th at 4 p.m. via Zoom. And either County Manager Morgus Baca or one of the commissioners, can you tell the public who is still with us or any of the attendees, can they just go to the county website for the Zoom links, or what is the best route to do that?
Madam Chair, yes, they can. So they can go to the county websites under, it's under meetings or commission meetings to do that. So it's pretty easy, pretty user-friendly, but if they have any questions, they can always give us a call.
Sounds great. Thank you so much. There being no further business tonight, this ABCGC plus APS meeting is adjourned. Thank you all very much.